Hi, my name is Gabriela Conti, and I'm working in the Center for Community Health and Prevention, and I'm the patient care manager of the Cancer Services Program of the Finger Lakes region. January is Cervical Cancer Awareness Month. Cervical cancer is a cancer arising from the cervix, which is the neck or the end of the uterus, and is due to abnormal cells that has the ability to spread or invade other parts of the body. Cervical cancer does not typically cause noticeable symptoms during the earlier stages of the disease. However, the identified symptoms of cervical cancer are likely to include irregular vaginal bleedings after intercourse, between menstrual periods, and after menopause. Another symptoms are pain during intercourse, vaginal discharge, and odor and pelvic pain. That's why it's vital for women to have regular pelvic exam and Pap tests to detect cancer in its earliest stage when it's treatable. The Pap test may not detect some cases of abnormal cells in the cervix. Therefore, HPV testing is recommended. The HPV test screens women for a high-risk HPV that may lead into cervical cancer. HPV refers to a group of viruses called human papilloma virus. Genital HPV is the most common sexually transmitted infection in the United States. HPV vaccines are vaccines that prevent infections by certain types of human papilloma virus. And all HPV vaccines protect against the HPV types 16 and 18, which cause the greatest risk of cervical cancer. HPV vaccine is routinely recommended for boys and girls at 11 and 12 years of age, and it also can be given as earlier as 9. The Cancer Services Program of the Finger Lakes region provides coverage for women 40 years and older for cervical cancer screenings. But if you are younger and you have any questions about cervical cancer screening, you can also give us a call. Our phone numbers are 585-224-3070, and for outside of the Monroe County, you can dial 1-877-803-8070. Thank you.